So the main purpose of this study was really to try to understand how lifestyle factors influence cancer outcomes. We know that there have been a lot of improvements in cancer mortality rates has been going down the past few decades, but the benefits have not been distributed equally. So some population groups tend to have better survival compared with others. So we're trying to look at low-cost, lifestyle-related changes that people can make to really improve their cancer survival. So that was the goal behind us conducting this study. And we focused on diet because several studies have shown that the type of diet you tend to use has an impact on your health outcomes, including cancer outcomes. So this was actually, this is a cohort study. We conducted this study using a cohort of healthy adults that were followed up over a period of 10 years. It was part of the REGARD study, and the REGARD study is a large cohort of adults who are healthy at baseline. And the main goal of that study was to look at stroke and cardiovascular disease outcomes. But since the study has been going on for so long, we were actually able to look at cancer outcomes. So we used this population of healthy adults. At baseline, we asked them what type of diets they ate, what types of food they ate, and how frequent it was. And there was really a lot of work that was done by colleagues at UAB, really characterizing the patterns of diet, like if you eat a lot of fruits and vegetables, or lots of meat, or lots of like fried foods. So we used that information that was collected when participants were enrolled, and then looked to see who developed cancer and who died of cancer 10 years later. Our primary findings was that of all the types of dietary patterns that we looked at, the southern diet was associated with the highest risk of mortality due to cancer. And southern diet is characterized by high-fat foods, organ meat, red meat, things like that. So it was the one that had the highest, the strongest association with cancer mortality. We found that in both blacks and whites, because that's one of the differences that we were looking for, was do all diets impact cancer outcomes equally in all population groups. So we found that in both racial groups, it was most significant for whites in our study, but it was still associated with higher risk of mortality. We also found that plant-based diet was protective against cancer mortality. So people who were vegetarians or who ate a lot of fruits and vegetables and salads and things like that actually had better outcomes. It's complicated. We need to go back and look deeper into what exactly, maybe break it down a little bit more. So maybe the bottom line is that convenience doesn't necessarily mean it's not healthy, but we just have to make sure that we are teasing apart, what convenience means, because now you have all this, packaged convenience foods that may actually be healthy, but we just have to make sure that we know exactly the nutritional content of the foods we are eating and the impact on outcomes. So the take home is diet is important for all health outcomes, not just for cancer. And so really encouraging patients, regardless of whether they have cancer or not, but especially when they have cancer, to really try to adhere to plant-based, not necessarily going vegetarian, but including a lot of fresh vegetables and fruits and lettuce and other plant-based items into their diet will be very, very helpful. It's low cost. We all have to eat, so we should try to just make it choose healthy options. It can still be tasty, but really trying to stay away from the all the meat products, the red meats, the fried products, all those unhealthy items may actually help to improve cancer outcomes.